Hi, this is Dr. David Tenner. We're here at the Goldberg Clinic, where we specialize in the reversal of chronic disease. And today I have the pleasure of being joined by Ms. Teresa Oakley. Ms. Oakley originally came to see us last year in February. That was in 2018. Fast forward now about 18 months. It's been about 18 months since you first came. It's now July 8th, 2019. Ms. Oakley originally came to see us with a rheumatoid condition that affected her joints. She's doing fantastic now. She's going to talk a little bit about her experience. So, I'll turn it over to you.
Okay.
Tell us a little bit about what brought you in, what your condition was at the time, and a little bit how the symptoms you were experiencing affected your life.
Okay. Yeah, first went to my regular doctor. He did blood work because I was starting to couldn't hold a cup or something. The strength in my hand was even getting worse. So they did blood work, said you have rheumatoid arthritis, you need to go see a rheumatologist. And I didn't want to go down that road. I don't want to be on medicine for the rest of my life. I've never, knock on wood, been on any medicine. So I thought, okay, we need to get a lifestyle change here. So researched many places on the web. Went to Progressive Medical, I think it is.
So there's a Progressive Medical Center in Atlanta?
Yes.
Okay.
So I went there and they did all kinds of tests and basically put me on a slew, wound up being very expensive, multi-supplements and things like that.
How many supplements do you think you were taking at the time?
Probably 10.
10 supplements?
Yeah. And she wanted to even put me on more, and I was like, I can't afford that. So then I researched Goldberg Clinic, came there with my bag of vitamins.
Actually, I remember that.
Yes.
You're not unlike many of the patients that come in, and we see sometimes people come in with suitcases full of pills they're taking, sometimes drugs, sometimes supplements, a lot of times a combination of them.
Mm-hmm.
All of that falls within the world of medicine.
Mm-hmm.
You have conventional medicine, which is the world of drugs and surgery, and then you have the hodgepodge of different types of alternative medicine, in which progressive medical will fall into. We've seen a number of patients who've been there, where patients are generally going to get usually a combination of drugs and piles and piles of supplements.
Mm-hmm. Mm-hmm.
But it still misses the boat. The real question to ask, as we asked with you, is what led to these problems developing?
Mm-hmm.
So we practice much differently. We practice an approach that we refer to as bio-hygiene, which is focused on looking at the causes of people's problems, addressing them directly, and then rather throwing pills and potions at people, we work to actually take the body as it is, break it down, and then rebuild it from scratch. So you essentially get new cells, new tissues, and ones that function a heck of a lot better than the ones you had before. So as I understand it, you were diagnosed with rheumatoid arthritis by your primary care physician. He referred you to a rheumatologist, but you didn't want to go. You knew you were going to get piles of drugs when you went there. You had pain in your joints. Which joints were bothering you at the time?
But my hands, fingers, my feet, my toes, and actually sometimes it would jump around. And my shoulders and my elbows. I mean, there were times when I would try to sleep and I couldn't because I was hurting.
So it interrupted your sleep, it interrupted your ability to just do basic everyday tasks?
Yeah, it got very frustrating.
Very frustrating, okay. So we worked up Teresa, we did a comprehensive evaluation, we developed a specific individualized program for her, and she really stuck it out. She had ups and downs. She worked through some tough periods, but she now 18 months later, let you tell the story. How are you doing?
I'm doing great. I'm at a 1.3, right?
Yes, so she's referring to her HSCRP, which is one of the best markers to measure inflammation. It's the primary way that we monitor, particularly a patient with rheumatoid issues and inflammatory problems, to monitor their status and see how they're doing. Teresa's HSCRP was originally 4.2. That stands for high sensitivity C-reactive protein, again a measure of inflammation and disease activity. 4.2 is elevated, should be less than 3, and ideally we like to see it around a 1 or lower. So originally at 4.2, then we rechecked it several months later, came down to 2.8, and now today we're at 1.3, which is not just normal but excellent. And has that now translated into improved symptoms? Are you feeling better?
Oh yes, yes.
What's changed? How are you feeling now?
I mean, my fingers, my hands, my feet, and there was some points. At one point, it would hurt to walk. It was very tender. I don't have that problem anymore. can hold a strong coffee mug very strongly, and it doesn't seem to jump around. I haven't had pain in shoulders or elbows,
Okay.
and yeah.
So
it's
the
just-
pain is as much reduced and gone. She has a grip strength, and she almost broke my hand today. Her grip is so strong. And are you feeling just well overall in combination
Yes.
with all that?
Yeah, even emotionally and physically.
Everything, because that's the
Yeah.
real key. We work with people that have just about every type of chronic health issue. We see a lot of people with rheumatoid arthritis, and we've had a good reputation of helping people over the years with that problem recover and reverse their issue, as Teresa has done. But one of the things that makes us unique is that we don't treat disease. We don't treat rheumatoid arthritis. We work with people to find out what's causing their problem, to address those factors directly, and then with the patient, work hard to uproot disease by having them follow specific steps, individualized for them, that change over time to gradually recreate their body and recreate their health. And Teresa was patient, she was perseverant, she worked hard, and she's earned every bit of the improvement that she's had.
Yep.
And in conjunction with that, we're now not going to need to see her as often because we've taught her the kind of things she needs to do now to keep herself healthy. So Teresa is becoming her own doctor, not going to be dependent on us, and we'll see her periodically. We're going to see her again in 6 months, but for the most part, she can start taking the reins over from here. So do you feel like you've been equipped with the tools needed to take care of yourself now?
And it's very empowering because I'm like, I can, like you said, with your guidance, I can help myself, and it's a lifestyle change, but I've done it and I can do it.
Absolutely. So Teresa, thank you.
Thank
you
you.
for sharing your story. I think your path to getting well will serve as an inspiration to others suffering with similar problems.
I hope so.
And we look forward to continuing to keep you healthy in time.
Yep.